Why does 42 CFR Part 2 exist? Have you ever wondered why there are specific laws protecting the privacy of individuals seeking help for substance use disorders? The regulation known as Title 42 Code of Federal Regulations, Part 2 exists for several important reasons. First and foremost, it was created to provide strong privacy protections for individuals seeking treatment for substance use disorders. This regulation ensures that sensitive information about a person's diagnosis, treatment, or referral for substance use disorder remains confidential. The confidentiality provided by this regulation is vital. Many people are hesitant to seek treatment due to the stigma and discrimination surrounding substance use. If individuals fear their information might be shared without their consent, they may avoid getting the help they need. Title 42 Code of Federal Regulations Part 2 helps alleviate these fears by providing legal assurances that their information will be kept private. This regulation specifically applies to Part 2 programs. These are federally assisted programs that offer diagnosis, treatment, or referrals for substance use disorders. These programs receive federal funding from sources like Medicare, Medicaid, or grants aimed at substance abuse prevention and treatment. Title 42 Code of Federal Regulations Part 2 mandates stricter standards for protecting patient records than those required by the Health Insurance Portability and Accountability Act. While the Health Insurance Portability and Accountability Act also governs health information privacy, it is less restrictive in some areas. One of the key reasons Title 42 Code of Federal Regulations Part 2 exists is to protect patient confidentiality. It limits the disclosure of substance use disorder treatment records to situations where the patient has given written consent or where the law specifically allows it, such as certain court orders. This helps prevent unauthorized sharing of sensitive information. Another important aspect is that it encourages individuals to seek treatment. The fear of having their information shared with employers or insurers can deter people from getting help. Title 42 Code of Federal Regulations Part 2 reduces this fear, allowing individuals to seek treatment without worrying about their privacy being compromised. Additionally, while Title 42 Code of Federal Regulations Part 2 restricts disclosure, it has been amended to better align with the Health Insurance Portability and Accountability Act. This alignment allows for some sharing of information within healthcare teams to improve treatment coordination while still protecting patient rights. For providers and human service professionals in addiction treatment, understanding and complying with Title 42 Code of Federal Regulations Part 2 is essential. It ensures that they respect patients' legal rights to privacy while navigating the complexities of treatment. This is especially important when working with vulnerable populations, such as minors or individuals with co-occurring disorders. Providers must obtain informed consent before sharing information and be aware of the specific legal exceptions that allow disclosure without consent. In summary, Title 42 Code of Federal Regulations Part 2 exists to safeguard the privacy of individuals with substance use disorders, reduce barriers to treatment, and promote trust between patients and treatment providers. This legal framework complements ethical obligations in addiction treatment by imposing strict confidentiality requirements that protect patients beyond general healthcare privacy rules.